Have you ever wondered if the familiar things we do every night before going to bed, the seemingly harmless habits that we have maintained for many years, could be a hidden killer, silently threatening our health and even our lives, especially when we enter old age? It sounds a bit scary, but the truth is, according to data from the U.S. Centers for Disease Control and Prevention, CDC, each year more than 70,000 elderly people die in their sleep. It is worth mentioning that most of these deaths are not due to old age alone, but come from completely preventable sleep-related habits. As we age, our bodies become more sensitive. After the age of 60, the heart, brain, and respiratory system all become more fragile. Sleep cycles change, muscles are no longer flexible, and the risks from seemingly small habits multiply. Yet many of us still carelessly repeat old habits, not knowing that we are putting ourselves in danger. Today, we will peel together 7 common but extremely dangerous sleeping habits. Habits that have caused many unfortunate consequences for many elderly people. In particular, habit number 6 is considered the final boss in terms of danger level. You definitely should not ignore it. But don't worry too much. Besides pointing out the mistakes, I will also share specific solutions, simple changes that you can apply from tonight to have a good night's sleep and good health. 7 dangerous sleeping habits to avoid. We will go through each habit one by one, analyze carefully, and find the most optimal solution. Habit 1. Drinking too much water before sleep. Everyone knows that drinking water is good, even extremely necessary, especially for the elderly, to help the body function smoothly and cells be nourished. However, no matter how good it is, if it is done at the wrong time, it can be harmful, especially drinking too much water right before going to bed. As we age, our bodies undergo natural changes. The kidneys, the organs that filter and balance water, no longer function as effectively as when we were young. The bladder also loses its capacity, and the alarm signal to urinate comes more frequently and urgently. This means that if you drink a large glass of water, a cup of tea or juice just 1 to 2 hours before bed, there is a high chance that you will have to wake up in the middle of the night. Take care of yourself. Waking up once or twice may not seem like a big deal, but for the elderly, each time it does, there's a potential risk. The CDC has shown that going to the bathroom at night is one of the leading causes of falls in older adults. Imagine you are drowsy, it is dark, your blood pressure may drop slightly when you stand up, and your ability to maintain balance is reduced. A careless step can also lead to serious injuries, greatly affecting your health and independence. Not only that, waking up continuously will disrupt the natural sleep cycle. You will miss the golden stage, deep restorative sleep, when the brain and body repair and recharge themselves. This condition, if prolonged, can lead to memory problems, increased inflammation in the body, and even increased risk of dementia and Alzheimer's disease. The immune system is also weakened, making it more difficult to control chronic diseases such as high blood pressure and diabetes. Another potential risk is cardiovascular disease. Drinking too much water makes the body work harder to process the excess fluid, causing fluctuations in blood pressure and putting an extra burden on the cardiovascular system, especially for those who already have heart disease. Sometimes it can trigger attacks, unwanted arrhythmias. So what's the solution? The key is when and how much. Drink enough water throughout the day, but reduce it in the late afternoon and evening. Try not to drink a lot of fluids at least 2 hours before going to bed. If you're thirsty, take only small sips. Avoid diuretic drinks like coffee, strong tea, and some fruit juices in the evening. If you have to get up to go to the bathroom, make sure the path is well lit and clear of obstacles. Move slowly, allowing your body to adjust before standing up. Just 1 glass of water at the wrong time can disrupt your sleep, increase your risk of falling, and affect your cardiovascular system. But if you think only water is a problem, you're not alone. Because there's another familiar habit, seemingly a way to sleep easier, that secretly sabotages your body every night. That's the habit of eating late at night, and the consequences are actually more serious than you think. Habit 2. Eating late at night. Make a late night meal. A bowl of hot porridge, a few cookies. For many people, it is a pleasure, a way to fill the stomach and sleep easily. But ladies and gentlemen, for the elderly, this habit is like a time bomb for health. Not just indigestion. As we age, our body's metabolism slows down, and our digestive system is no longer as energetic as before. The ability to regulate blood sugar and cholesterol also decreases. If you eat late at night, especially heavy, greasy foods, your digestive system will have to work overtime all night. Well, that should be the time for your body to rest and recover. This not only disrupts sleep, but also puts a lot of pressure on the heart and other organs. One of the earliest uninvited guests when eating late at night is heartburn and acid reflux. When you lie down right after a meal, stomach acid can easily reflux into the esophagus. For older people, this condition is not only uncomfortable, but can also lead to chronic esophagitis, mucosal damage, and even the risk of aspiration pneumonia if food or acid gets into the lungs. According to a study published in the American Journal of Gastroenterology, people who eat within 3 hours of going to bed are at significantly higher risk of nocturnal reflux and related complications. The risks don't stop there. Late-night eating, especially sweets or refined starches, can cause blood sugar levels to spike. Older people's bodies are already less sensitive to insulin, the hormone that regulates blood sugar. Therefore, a late-night snack can cause blood sugar to rise all night, increasing the risk of type 2 diabetes or making the condition more difficult to control. A 2020 study in the Journal of Clinical Endocrinology and Metabolism found that late-night eating is associated with higher blood sugar and insulin levels the next morning. Especially in older adults, the heart is no exception. Late-night eating can cause blood pressure to remain high throughout the night instead of naturally dropping during sleep. This type of restless blood pressure is closely linked to a higher risk of heart attack and stroke. Fatty meals can also trigger arrhythmias, which are dangerous for people with underlying heart disease. How to protect yourself. Try to finish dinner at least 3 hours before bedtime. In the evening, choose light, easy-to-digest foods such as steamed fish, boiled vegetables, and a little whole grains. Instead of fried foods, lots of red meat, or sweets. If you really need a snack, choose a small piece of fruit, a jar of unsweetened yogurt, or a few almonds. A seemingly simple late-night meal can lead to a chain of dangerous reactions, from digestive disorders, gastric reflux to increased risk of stroke and diabetes. But even if you eat on time, there's another factor that is silently threatening your health during sleep. That is the wrong sleeping position. And many elderly people are suffering from it. Habit 3. Sleeping in the wrong position. Most of us have a gut sleeping position that we feel most comfortable with. But did you know that this seemingly simple sleeping position can silently affect our health, especially when we get old? For the elderly, choosing the right sleeping position can make a big difference, helping to prevent respiratory and cardiovascular problems, and even stroke. The most disruptive position is lying on your back. Although it may seem comfortable, when you sleep on your back, gravity pulls your tongue and soft tissues in your throat down, narrowing or partially blocking your airway. This is especially dangerous for people who snore or suffer from sleep apnea. Research from the Mayo Clinic Sleep Disorders Center shows that sleeping on your back can worsen breathing problems by up to 40% compared to sleeping on your side. The consequences of obstructed breathing are serious. Reduced oxygen flow can lead to episodes of obstructive sleep apnea. Prolonged lack of oxygen can cause brain damage, increased blood pressure, and increase the risk of stroke and cardiovascular events. In fact, a study in the Journal of Clinical Sleep Medicine found that older adults who sleep on their backs are 22% more likely to have nocturnal cardiovascular events than those who sleep on their sides. In addition, for people with acid reflux or hiatal hernia, lying on your back makes it easier for stomach acid to flow into the esophagus, causing damage and increasing the risk of choking. Another aspect that few people expect is the impact on the brain. Research from Stony Brook University revealed that lying on your back reduces the efficiency of the brain's waste elimination system by 63% compared to lying on your side. This means that harmful proteins associated with Alzheimer's disease are not eliminated effectively, which can promote cognitive decline. Lying on your right side is also not the optimal choice, because it can put pressure on the heart's large blood vessels, hindering circulation. So what is the golden position? Experts unanimously advise us to lie on our left side. This position helps improve blood circulation, aids digestion, and reduces the risk of acid reflux and stroke. It also helps the brain clean up more effectively. To change your sleeping position, try using a pillow between your knees to keep your spine straight. Place a pillow behind your back to avoid accidentally rolling onto your back. Using an orthopedic neck pillow is also a good idea if you have reflux. Elevate the head of your bed slightly. Incorrect sleeping positions can cause suffocation, reduce blood circulation, and increase the risk of dementia. But even if you are lying properly, there's another factor in your bedroom that can seriously disrupt your sleep. The room temperature is too high. It sounds simple, but the consequences are not small at all. Habit 4. Sleeping in a room that is too hot. When the weather is cold, many people have the habit of turning on the heater to make the room really warm, covering themselves with a thick blanket to have a good night's sleep. However, a bedroom that is too warm, while seemingly comfortable, can secretly harm the health of the elderly. Our bodies have a natural mechanism to lower their core temperature slightly when falling asleep. This is a signal to the brain that it is time to rest, helping us to easily fall into deep sleep. When the bedroom is too hot, usually above 21 degrees Celsius, about 70 degrees Fahrenheit, this cooling process is hindered. Instead of relaxing, the body has to work hard to release heat, causing you to toss and turn, have difficulty falling asleep, or wake up feeling tired the next morning. For the elderly, the ability to regulate body temperature has decreased, so they are more susceptible to being affected by a bedroom that is too hot. Research in the American Journal of Geriatric Psychiatry shows that older adults who sleep in rooms with temperatures above 70 degrees Fahrenheit can experience up to a 30% reduction in slow-wave sleep, a deep sleep stage that is crucial for memory recovery, immune function, and cell repair. A lack of this important sleep stage can have a domino effect: increased inflammation, high blood pressure, a weakened immune system, and an increased risk of heart disease, diabetes, and cognitive decline. Sleeping in a hot room can also lead to dehydration due to sweating, thickening of the blood, increased risk of blood clots, heart rhythm disturbances, and even stroke. What is the ideal bedroom temperature? Most experts recommend keeping your bedroom temperature between 60 and 67 degrees Fahrenheit, 15 to 19 degrees Celsius. Choose bedding made of light, breathable materials like cotton. Avoid heavy blankets or electric blankets that retain heat. If you feel cold, add a thin blanket that can be easily removed. Use a fan or open a window to circulate air. A bedroom that is too hot makes it difficult to fall into a deep sleep, increases blood pressure, disrupts heart rhythms, and speeds up the aging process. But the danger doesn't just happen while you're sleeping. It also happens the moment you open your eyes and sit up. Getting out of bed too quickly, a seemingly harmless action, is the cause of countless falls in the elderly. Habit 5. getting out of bed too quickly. When the alarm clock rings, or you suddenly wake up in the middle of the night because of a strange noise, do you have the habit of jumping up very quickly? If so, be careful. This seemingly normal action is a dangerous trap, especially for the elderly, causing countless falls and injuries. The main culprit is orthostatic hypotension. This is a condition in which blood pressure drops suddenly when you move from lying down to sitting or standing too quickly. In the elderly, the ability to regulate blood flow and blood pressure when changing positions is less effective. As a result, blood temporarily rushes to the lower body. The brain does not receive enough oxygen for a few seconds, causing dizziness, lightheadedness, and even lightheadedness. It's not just a passing discomfort. According to a study in JAMA Internal Medicine, older adults with orthostatic hypotension are at significantly higher risk of falls, fractures, and death. And falls are the leading cause of hospitalizations for injuries in older adults. According to the CDC, the consequences of a fall at night can include hip fractures, head injuries, long recovery times, and serious loss of independence. So, can you prevent it? It's simple. When you wake up, don't rush to get up. Sit on the edge of the bed for a few minutes to give your body time to adjust. While you're sitting, wiggle your toes, rotate your ankles, and take a few deep breaths. This helps your blood circulate again. Keep a small glass of water next to your bed and take a sip before you get up, especially if you have a dry mouth. Make sure the path in the room, especially to the bathroom, is well lit and clear. When standing up, hold on to a solid support. A sudden stand-up can cause a drop in blood pressure, dizziness, and dangerous falls. But sometimes, it is the lack of sleep that is the biggest threat that few people realize. Snoring, pauses in breathing during the night, or prolonged insomnia can all be warning signs of serious illnesses, even life-threatening. Habit number 6. Ignore snoring, sleep apnea, or insomnia. Now, we come to the habit I warned about from the beginning, the most dangerous habit, capable of silently but extremely frighteningly destroying health. That is ignoring abnormal signs in sleep, such as loud snoring, pauses in breathing, or prolonged insomnia. Snoring. Many people still jokingly consider it a specialty of old age, or a little wheezing is okay. But ladies and gentlemen, if that snoring is accompanied by moments of silence, then gasping like someone who has just escaped drowning, it could be a sign of obstructive sleep apnea. This condition occurs when the throat muscles relax too much, narrowing or completely blocking the airway. Breathing can stop for a few seconds, even minutes, repeating hundreds of times each night. Each time breathing stops like that, the oxygen concentration in the blood drops. The heart has to work harder to pump blood to nourish the body. Like that, night after night, the heart is worn out, leading to high blood pressure and arrhythmia. According to the Sleep Heart Health Study, untreated sleep apnea increases the risk of fatal heart attack by 30% in stroke, by up to 60% in older adults. Alarmingly, it is estimated that nearly 40% of older adults are affected by sleep apnea. But up to 80% of cases are not even aware that they have the condition. The brain is also a victim. Lack of oxygen and interrupted sleep impair memory, cause confusion, and even accelerate brain atrophy in areas that control memory and decision-making at a rate nearly 3 times faster than normal aging. Warning signs of sleep apnea include very loud snoring, irregular snoring, sometimes stopping abruptly, waking up with a feeling of suffocation, gasping for breath, severe daytime sleepiness, despite getting enough sleep at night. Morning headaches, dry mouth upon waking, difficulty concentrating, memory loss. In addition, prolonged insomnia, difficulty falling asleep, difficulty maintaining sleep, cannot be ignored. It not only weakens the immune system, increases stress, but can also be a sign of other underlying health problems. If you or a loved one has any of the above symptoms, don't hesitate to see a doctor or sleep specialist immediately. Treatments such as CPAP therapy, continuous positive airway pressure, lifestyle changes, and weight management can significantly improve the situation. Research shows that treating sleep apnea can reduce the risk of cardiovascular disease by up to 42%. In older adults, don't let snoring or restless nights take away your health. Listening to your body and taking timely action is the key. Habit 7. Taking some medications before bed. Last but not least, is the habit of taking certain medications at night without being aware of the potential risks. Blood pressure pills, sleeping pills, painkillers. For many older people, these are familiar companions every night, but are they always good friends? Some medications, when taken at night, can cause unwanted side effects, especially as our bodies age. Sleeping pills and sedatives, medications such as benzodiazepines, often ending in PAM like diazepam, clonazepam, alprazolam, help us relax and fall asleep by slowing down the central nervous system. However, they also make breathing slower and shallower, which is dangerous for people with heart or respiratory disease. A study in the British Medical Journal showed that older people who regularly take benzodiazepines have a significantly higher risk of falling, breaking bones, and even dying. The sedative effects of the drug can last until the next morning, causing dizziness, confusion, and increasing the risk of accidents. Some antidepressants, muscle relaxants, taking them at night can affect deep sleep, negatively affecting memory and cognition. NSAIDs, pain relievers, such as ibuprofen, diclofenac, regular use can overload the kidneys and liver, increasing the risk of internal bleeding, especially when combined with other drugs. Blood pressure medication. Although some people are advised to take it at night, for others it can cause blood pressure to drop too low while sleeping, reducing blood flow to the brain, causing dizziness, fainting, and even stroke. The time to take blood pressure medication needs to be carefully prescribed by a doctor. Drug interactions. Elderly people often take many types of drugs at the same time. The risk of drug interactions causing dangerous complications is very high. 2. Stay safe when taking medication. Always consult your doctor or pharmacist before starting, stopping, or changing any medication, including when to take it. Ask carefully about possible side effects, especially dizziness, excessive sleepiness. Avoid overusing sedatives and sleeping pills. Prioritize natural remedies such as herbal teas and relaxation techniques. If you take blood pressure medication at night, monitor your blood pressure regularly and report any abnormalities to your doctor. Many elderly people take medication at night to help them sleep or control their condition. But if used incorrectly, the consequences can be very serious. Finally, we have just reviewed 7 seemingly normal sleeping habits that pose many risks to the health of the elderly. From drinking water, eating, sleeping position, room temperature, how to get out of bed, to recognizing abnormal signs of sleep and how to use medication. All require caution and understanding. Sleep is not only for rest, but also a golden time for the body to recover and regenerate energy. A quality sleep is the foundation of good health and a happy, clear life. Hopefully, after today's program, you have gained more useful knowledge to adjust your nightly habits, starting with the smallest changes. Don't hesitate to share this information with your relatives, friends, especially the elderly around you. Have you ever accidentally made any of these mistakes? Or do you have any tips for better and safer sleep that you want to share? Please leave a comment below. We look forward to hearing your stories and experiences. Once again, thank you for taking the time to watch. Don't forget to like and turn on the notification bell so you don't miss the next useful videos. Wishing you always have a good night's sleep and good health. Hello and see you again.